Well, welcome back to another episode of The Compass with Dr. Brad Robison. And so excited about the topic today. We're talking about how to navigate ADHD. And I think you're talking about just this time of the year, school kind of back in session from the Christmas break, and you're getting a lot of referrals for ADHD. Can you talk a little bit about the process that a family might go on?
Sure. Yeah, this time of year, I mean, part of the thought about bringing this topic up this time of year is, moving into the third quarter, and that third quarter just seems to drag on for students and parents and teachers. I think that third quarter is tough, and it's also we get a lot of referrals around the time of first quarter grades, but I think we get probably even more after the Christmas break, moving into the third quarter, because there's a lot of the kind of hitting the panic button and going, oh my goodness, yeah, he's
There's also no fall break, Thanksgiving break, Christmas break. Like
yes,
you
exactly,
get a long stretch in there without a breather.
long stretch, and there's that sense that oh wait a minute, grades aren't turning around. We're first part of the school year. You keep thinking, okay, well, let's work on this or that, and hopefully things will turn around. And then by the third quarter, it's like, oh man, things aren't turning around. And so we get a fair number of referrals this time of year because of students struggling academically. And so, yeah, I thought it'd be a good topic to talk about. I know a lot of parents, grapple with that and wonder about, okay, what do we need to do? When should we be calling somebody for some help or support and that sort of thing?
Well, I think that's just a great sort of foundation of maybe why they've ended up there. It's interesting too that you're talking about grades as a part of that. What are the primary signs and symptoms that uh, may pique somebody's interest for ADHD, as far as like a teacher or a counselor at school that may end up with a referral? Because it's not always grades, right? And there are other attention behavioral issues that may
Yeah,
not be
yeah,
ADHD.
yeah, exactly, exactly. Yeah, grades are the thing a lot of times that kind of bring it to the attention of the parents and teachers. Also behaviorally, I mean, they may be struggling with behaviors in the classroom, at home, that are disruptive and causing disruptions that are starting to get to a point where family and teachers are saying, maybe we do need to look at this and look at what is going on here. And with that in mind, I mean, probably in some ways, maybe a good starting point would be to just discuss what ADHD is. Like, of course, there's lots of other reasons why a kid may be having difficulties academically or behaviorally, but let's focus on the ADHD for a minute. ADHD's been, well studied. It's not, at this point, it's not a obscure diagnosis or anything. It's been very well studied. Probably one of the most well studied. If you just look at sheer volume of scholarly papers written on the subject, it's probably one of the most well studied disorders in pediatrics. And the percentages in the general population, 3 to 5% roughly. Again, it varies, but 3 to 5%, and you see that across cultures. That's one of the things that does help us begin to understand, if something is quote unquote a real diagnosis or not. It's like, well, yeah, there is something going on, because you see similar percentages across cultures in various research. And of course, there's some variability there, but part of the thing then about what ADHD is the DSM, the latest version of the DSM-5 has, a list of criteria and symptoms of in the three main domains or categories: inattention, hyperactivity, and impulsivity. I mean, those, these days with Google, those are easily looked up, but, it's, I'm not going to just read them, but, the having difficulty sitting in their seat, their, motor activities sort of wound like a top. They're constantly going and squirming and wiggling and up and down out of their seat, blurting out answers, get distracted and lose track of things or lose track of a train of thought, lose things like, forget they may be very intent on doing their schoolwork, but they can't stay organized enough to, they lose their pencil and they spend, more time than their peers trying to find their pencil to do their schoolwork. And then they find their pencil and, in their rummaging through their desk or their backpack, they've lost or crumbled up the assignment sheet. And then and so you have this constant, you know, disorganization related to inattention, distractibility. They do tend to be more impulsive. Kids tend to be impulsive, but the example that I give sometimes is, it's very normal for kids to test limits and sometimes be impulsive to kind of run right up to the edge of the line, and like of whatever the limit is. That's age appropriate, normal at times. But the kids with ADHD are the ones that more often than their peers are two steps over the line, falling off the cliff before they realize, oh, wait a minute, that, I should have done that. I should have, controlled my impulses and reined that in. And so that's a little bit about some of the diagnostic criteria, again, without just kind of reading the DSM, but a little more of the nuance, I think, that's important for parents to understand in thinking about ADHD is one of the things that I see with lots of the diagnoses that I deal with, but ADHD probably is much or more than any, is I still think there's a misunderstanding out there about categorical versus dimensional diagnoses. And so a lot of times, and sometimes even amongst the criticism that you'll hear about ADHD diagnoses and all of those sort of things, and there's some legitimate criticism. I mean, I certainly don't, I think as a culture we can overdo things sometimes with kids and diagnoses and all of that. But well done evaluations do a pretty good job of defining this. But there's confusion over dimensional versus categorical diagnoses, and a dimensional diagnosis, lots of diagnoses in medicine are dimensional, like high blood pressure, blood sugar, diabetes. High blood pressure is a good one because, everybody's got a blood pressure. Nobody argues that a blood pressure of, 210 over 160 is a medical emergency and needs treatment. But what do you do with a blood pressure of, 140, 145 over
85 or something.
or 85? Yeah, exactly. I mean, cardiologists have gotten together over the years and said, well, so the number for the diagnosis of hypertension has drifted down over the years, because if you have a consistent presentation with a blood pressure above this amount, and you follow those individuals over time, there's a breakover point where there's a higher risk of negative outcome. Well, that's a dimensional diagnosis as opposed to a categorical diagnosis. A categorical diagnosis is like a broken bone. It's either there or it's not there. I mean, even that, there can be shades of gray. But ADHD is like blood pressure. It's a dimensional diagnosis. Aren't all, boys, hyperactive? Well, yeah, to a matter of degree. But when you're really doing a good job of, doing a good diagnostic evaluation, getting good data from families, from time with the kiddo, from teachers, you're beginning to look at a set of kids that are 2 standard deviations above the mean. So there's a range of normal, but we're really looking at the kids that are 2 standard deviations above the mean, and those are the ones we're wanting to identify as ADHD. So why do we want to identify those kids as ADHD? Well, yes, if they're having some problems right now in class, we would like to be able to reduce the problems that they're having. But just like blood pressure, why we really want to identify those kids is we do know if it goes untreated, those kids are much more likely to have significant academic difficulties as they move into junior high and high school. They're much more likely to have school failure. They're much more likely to have a significant drop in self-esteem, because as they get older and older, their peers are learning to self-regulate and be more organized, and they're not. And so they sort of have this drift towards a more and more negative peer group. They're 4 times more likely to have a car wreck in the first year of driving.
Wow.
So what you're really looking at is you're looking at the consequences of not treating the symptoms. They're
Mhm.
more they're more likely to have. There's been good research to support that there's significantly higher risk for developing a substance abuse disorder in adolescents. ADHD kids are, not because of, and there's been research on that, because there's been questions about, well, putting kids on stimulant medications, does somehow being on a stimulant, because people equate that with a medicine that could be potentially abused. But what the research actually shows is well-treated ADHD is those kids are significantly less likely to have develop a substance use disorder than untreated ADHD, because of the impulsivity. If you get the impulsivity calmed back down, and because of the self-esteem drift, if you get the impulsivity calmed back down, they're successful in school, they're successful with their peers, they're much less likely to gravitate towards substances and those sort of things. So that's a huge part of why we treat. Another thing along those lines too, because sometimes um, this does become a question about, should we treat, should we not treat? There is this question of effect size that's an issue. So, like, if you take a kid that's, well, medication management and treatment for ADHD, you're likely to get, this is rough. The research data is kind of all over the place, but my rough clinical number, I usually say 50 to 70% reduction in symptoms. You're likely to get about a 50 to 70% reduction in symptoms. Well, if you take a kid that's 3 standard deviations above the mean, I mean they've got a lot of ADHD symptoms, and you reduce it 50 to 70%, you're going to see a difference.
Mm.
Grades are going to be better. There's interactions with peers and adults are going to be better. You're going to see a difference. If you've got a kid that's 1.5 standard deviations above the mean, or a little less, and again, that's when you would start being like, we probably wouldn't call that ADHD, and we probably wouldn't treat. Partly because the effect size is going to be small. You could still maybe reduce the amount of symptoms by 50%, but from here to here, probably not really going to see much difference in actual functional levels. So that's a big issue. We're really treating. We want to get a good effect size, and we want to see a good functional improvement over time to reduce those long-term risks.
I think some of what people talk about when they're discussing children with ADHD is that it's sort of become a replacement for discipline.
Yeah.
And so they would say, we don't need to medicate these kids. And then you look at some kids that probably didn't need the medicine and were over medicated. And I think that's some of what makes your practice so different, because you're actually getting in the weeds
Yeah.
with the families and with the kids and spending a lot of time with them. Can you just talk about those lines of efforts and how you sort of discern what to do when?
Huge. Yeah, that's a huge part of the deal, and that's a big part of why, like, we spend time. We do, 2 hour initial evaluation with the child and the family, even if we're only, I say only, even if we're only, I mean, doing medicine management, quote unquote medicine management. For us, that's very different than some practices. I mean, we're spending time, at least 30 minutes, with each appointment, and we're spending some time with the kiddo, but we're also spending time with the parents, and we're talking about all these things, and we're talking about the fact that medicine management's only one part of this. And the a huge part of this treatment is effective authoritative parenting, which is true for all kids, right? And you have to have that in place. And a kid with ADHD is a little harder to parent than a real laid back, easy to parent kiddo. But parenting is incredibly important in child behavior and those sort of things. And so, yeah, I certainly do see at times where, um, I mean, again, the vast majority of parents are loving and caring and all of that, and so we have lots and lots of great parents that are really concerned about their kids, and, you know, are willing to put in the time, but there is medications is certainly no substitute for time, you know,
Mhm. Mhm.
I can't make up, I can't in a pill form make up for just lots of time with kids.
Yeah. No, I think that that's important. Also, we're talking about maybe some of those behavioral interventions that are needed, and you're talking about
Yeah,
some lines of efforts. But there's also a superpower to ADHD too, right? Like there's
yeah,
always a pro and a con, but I know that a lot of people have the ability to, when they're interested in something, to kind of hyper focus, and
yeah,
excellent results can come from
yeah,
something like that.
yeah. Yeah, I think so. I mean, I think that there are certainly kids with ADHD that, so it's an attentional problem, and sometimes that people don't, quite understand how that works. But there is this, for some kids, they just can't focus at all. But for other kids, they have significant difficulty shifting focus from a preferred interest or something that they're get hyper focused on, and then they have difficulty shifting when they need to. So those are some aspects of things that you're looking at. Another which it can be a problem, but as they get older, if they learn how to manage that hyper focus
Hmm.
and be able to shift, it can be a positive. Another thing that I think is really interesting when you look at the neuropsych data on kids. I don't remember the percentages. They're out there that people have talked about this, um, but it's a fairly high percentage of ADHD kids compared to the general public are more visual global. So if you just have if you have a a general population and you do the neuropsych testing, I think it's fairly evenly split, or more dominantly auditory linear. Most people process
Hmm.
things, in a auditory linear step by
Hmm.
step fashion. In the ADHD population, a significant amount of kids, and adults with ADHD are more visual global. And
Yeah.
so if you think about that from the standpoint of traditional education, and things have changed in education over the years, which has helped with this, but still there's some of that sense in traditional education, especially through the elementary years. A lot of how we teach is auditory linear.
Hmm.
So the kids with the more visual global processing have more trouble if they can get through some of that and start really developing their visual global processing. They can move a lot faster through large amounts of information.
Yeah.
Another way, some of that may be confusing to folks. Let me back up and describe it like this. From the frontal lobes of the brain are like the blackboard of the mind is one way to look at it. That's where executive functioning happens. And, one way to look at it is the frontal lobes are like the blackboard of the mind. And our attentional system is like a gating system that like kind of takes in information, because we're taking in auditory, visual, sensory, touch. We're taking in the way our clothes feel. We're taking in all this information all the time. And the attentional system weeds out what gets written on the blackboard of the mind. So it limits what's there, so that then when we're paying attention, because we need to problem solve the information on the blackboard, we have a limited amount of things that for the most part go together, and then we can kind of put them together and sort that out. Kids with ADHD, a lot of times the blackboard's cluttered. There's just tons of stuff up there, right? And so it's really hard for them sometimes to weed out, well, what part of this goes together? Well, if I'm trying to solve a problem, well, what are the things that I need to solve the problem? And that requires a degree of linear processing. And so for younger kids, that's a real challenge.
Mm-hmm.
As they get older, if they've learned how to master this, they get better and better at being able to see patterns and big pictures quickly. So they begin to be able to go, oh, okay, yeah, this and this, and they can kind of, move through the clutter on the blackboard really quickly. And so a lot of times those kids become really skilled at, academic pursuits and jobs that require them to move through big volumes of information, quickly. Yeah.
That makes a lot of sense to me. Now, do you think that ADHD is genetic, or is it environmental, or is it a mix of both?
I mean, that's a great question. And my researcher folks out there, the people that really get into the research, man, you could really go down that path, and try, and all that. The clinician in me says, to some extent, it's both. Now, like from a research standpoint, if you're really using research level criteria and you're really very detailed in what you call ADHD, yes, it has a strong genetic predisposition, and it also is cross-cultural. In other words, it shows up across cultures. So it does lend a lot of support to the fact that there's a strong for core well-defined ADHD. There's a very strong genetic and biologic component to it. Now, like I said, the clinician in me says that while that's true, there are certainly kids that probably have a similar, like, child A and child B. Child A, they may have a very similar level of biologic inattention, impulsivity, but if one child has grown up in an atmosphere that's really helped them learn to manage that well versus another child who maybe hasn't had that support, there'll be a huge difference in their presentation.
Mm-hmm.
Yeah.
Does caffeine impact ADHD?
I mean, yes, probably. Sometimes people think it's a potential treatment for it. I don't see it as helpful in many ways. It may worsen it. I know some people swear that their kids are a little better if they have a little bit of caffeine.
That's why I asked that. I hear that all the time.
Yeah.
Give them caffeine. Actually, it puts them to sleep.
Yeah. And it's like, I'm not convinced that long-term, because of the half-life of caffeine and various things like that. And I'm not convinced that it's a very effective treatment with its own set of potential risks and downsides. But I think just healthy diet, healthy exercise, that stuff makes a big difference with ADHD. And then our treatments. I mean, the treatments that do have good data to support their effectiveness are the um, stimulant medications for ADHD, the methylphenidate based products, the um,
like Adderall?
yeah, well, yeah, Adderall is a uh, dextroamphetamine based medicine, and then methylphenidate would be a Ritalin type.
Okay, I see.
Yeah, yeah, but there's a bunch of different you know preparations out there now, and I mean, definitely talk to a good clinician. I mean, weigh out the pros and cons. There are pros and cons in the stimulant medications. Appetite suppression, worsening irritability, sleep disturbance. There are some downsides, but for a well documented ADHD case, there are also
Hmm.
it can really help. It can make, you know, letter grades difference in academics. It can help them
Hmm.
engage more effectively with peers, help their self-esteem. Some of the stuff we talked about earlier. I mean, I've got a lot of students that, their parents and I are pretty meticulous about making sure that they are taking their medications before they go out driving, because of that data. Four times more likely to have a car wreck in the first year of driving. And, Tyler, I mean, I tell people this a lot. I've been doing this for 30 years, and I have been fortunate that in many ways I haven't lost very many at all teenagers in my practice over the years, but some. And I've lost more teenagers in my practice to car wrecks than I have to suicide.
Wow.
I mean, when I say four times more likely to have a car wreck in the first year of driving, I take that really seriously. Like that's significant for an adolescent driver who are at higher risk for having a car wreck anyway. uh, that's a big deal. And so making sure that those kids are, effectively treated and trying to prevent their risks of car wrecks is a big deal.
Is it a lifelong diagnosis or does it lessen over time?
Yeah, it's interesting, and that's also an interesting area for the researchers. I mean, the researchers would parse that out in lots of detail. For the clinician side, for me, the way I look at it, the research is there does clearly seem to be about a third of kids that by junior high have probably neurologically matured to the
Mm.
point that it is significantly better and they may not need to be on medications. And then I think there's another third that by the time they graduate from high school are significantly better. But the research data supports this to some extent. And my clinical experience with it is I think that group is actually the group of kids that have just learned to cope with it by the time they, transition out of high school into college and don't need the medicines. They probably still have a little bit of the neurobiology and, a good neuropsych exam, probably in terms of like a good neuropsych exam, meaning the really looking at the way their brain is functioning, would probably look pretty close
Mhm.
to the same as a ninth grader as it does as a freshman in college. But by the time they're a freshman in college, they've really learned how to cope with it and to some extent turn it into the superpower that you were talking about and don't need to be on medicines. And then that leaves about a third that still are struggling enough that they may need some support and treatment, medicines or otherwise. Yeah.
That's interesting. Well, any final thoughts?
No, I mean, I think we've covered a lot. I mean, and again, just so people understand, I mean, we just covered kind of a quick overview. Pediatricians do a good job treating, younger kids with ADHD. What we end up seeing a lot of is the ADHD and, ADHD and anxiety, ADHD and Tourette's, ADHD and, which we can talk about more at some other point in time. But yeah, I think it's been a good overview of just kind of paying attention to some important aspects of ADHD and why it is important this time of year to pay attention to that.
I thought it was extremely helpful, and you actually taught me a lot about ADHD that I didn't know. And so I'm excited for people to get an opportunity to watch this. If you're interested in learning more, you can go to bradrobinsonmd.com, or you can call to make an appointment 573-334-7055. Thank you for tuning in to another episode of The Compass. I thought it was great.